I think there's a lot of women who would benefit from progesterone who don't know it, especially in your mid-30s, late 30s, early 40s, maybe in your 40s and some early 50 who just need progesterone. The estrogen and testosterone is fine, but they're having anxiety, headaches, migraines, sleep issues, irritability, heavier periods, and just overall feel really worse right before your period starts. And that seemed to have like worsened either after kids or like late 30s and the 40s, but everything else is fine. They're not having hot flashes. They're not having, brain fog, concentration, severe fatigue, any vasomotor symptoms, and everything else is fine, but it's just that little piece. And so progesterone tends to fall first in this perimenopause. Sometimes estrogen and progesterone both kind of go haywire and you need to replace both. But for a lot of women, and I've been doing this for a long time, for about 7 to 8 years, I've been doing hormone replacement therapy on women. And I also learned from my dad, who's doing hormone replacement therapy in the early 90s, and with bioidentical hormone replacement therapy, even when the Women's Health Initiative came out, he read the study and knew that hormones were not a problem and kept going and kept women on their hormones through that crazy time. So I've had a lot of experience, and I have a lot of women on progesterone, and I've solved a lot of problems with just progesterone for the right patient and the right candidate. So this is something that you should talk to your provider about. Not me, I'm not your provider, but if you're talking to somebody and you're noticing these issues and it's all like that right before your period, your headaches are getting worse, migraines, anxiety, irritability, sleep is worse, ask them about progesterone. I will use a oral micronized progesterone pill, especially people who have really trouble sleeping. I will use a topical compounded cream during the day as needed. It really just depends. It's something that you need to talk to your provider, not medical advice, in using in that luteal phase. Some women are on it continuously and they still have regular cycles. It doesn't inhibit their ovulation. It really just depends. But if you're a provider and you do hormone replacement therapy, don't underestimate the power of just progesterone for a lot of women.